Here we are in, wait for this, the cinema room. So we have the beautiful plasma screen, and we have the most fabulous collection of extremely comfortable seats. Ellie's stretched out on one, I'm stretched out on one. How comfy is that?
How's that?
That is pretty lateral, that is relaxed. Ellie, you were saying, but the room is used for things other than cinema shows?
It's cinema shows, it's a training room, it's a meeting room, it's a conference room, it's an anything you want to book it for room. We also book rooms out to generate an income as well. But from after 9 to 5 and on the weekends, this belongs to the lodges.
Right. And in fact, one of the patients was telling me that I think that he had seen Avatar, the film, and had enjoyed it. And the whole thing about the about public access to the hospital, in particular to this main part, rather than to the lodges, but to this sort of main building, Harrison House, is really unusual. Would you mind recapping on that?
Harrison House is open to the public. Any member of the public can come in. There's a cafe downstairs that's open to anybody. So you can also book these rooms as well as a member of the public.
That's extraordinary. And because of some funny sort of planning arrangements.
There's a football pitch across the road that has a governance on the land. So whoever bought the land that we built on had to provide the sports facilities for the football pitch. So downstairs we've got 4 changing rooms, referee rooms, physiotherapy rooms, all designed in line with World Soccer or FIFA or whatever the organisation is called.
That is amazing. I've seen many different facilities in hospitals around the country, but I've never come across a referee's room before.
We've got 4.
You've got 4. That is...
No, 2 referee rooms, because there's 4 changing rooms for 4 teams.
Oh,
so
God.
a home team and a away team would have a referee, wouldn't they? So 2 referee rooms, 4 changing rooms, and physiotherapy rooms.
Wow.
Should anyone need a bit of massage.
And Tukes. I mean, I was really excited about Tukes when I visited in the old hospital. It's a really unusual, I don't know, service and arrangement. Well, please, could you describe that sort of from scratch?
Tukes. Shall I send you some information on Tukes, because it's massive?
Yeah, but for the film. Yeah.
Tukes is a project run by Mental Health Services, initially set up a few years ago to start looking at getting people back into employment, service users back into employment. So we bought a property in town, and they initially started running a cafe from there and a catering facility, then a conference facility. Then they provided the cleaning services for the hospital, all the cleaning services for here, the concierge services, the laundry services, the gardening services, the maintenance services, as well as now taking over most of the GP practices in town for cleaning and those with the cafe running cafes. They also do the same for our older people service, which is on a different site. They do external catering, they do external garden maintenance, property maintenance.
Amazing.
And it's all run by paid employees, working members of the Tukes, which would be service users, and then service users getting back into employment. Through that scheme, a lot of people who wouldn't have got employment before are now employed, even to the level of nursing assistants. We've got several nursing assistants within service users that have come up basically through the cleaning service and then wanted to work with us. So through their own determination and through the interview process, we've got nursing assistants who become service users.
That is just fantastic. And the concierge role, never come across that before.
We didn't want porters. We don't like the norm. We like to be different. We didn't want porters running around with the typical thing you would see a porter doing. So we decided that we would, because we were a hotel standard, then a good hotel has a concierge. So we decided we would have concierges. So the concierges do the meeting and the greeting downstairs. So if can get visitors, they'll show people where they need to be on site. They do the reception work, they do maintenance work, gardening work. They're also trained in respect, which is the de-escalation and restraint techniques that we use. So they're all trained in that, so they respond to alarms and basically anything that we need to help us out.
So it's the most extraordinarily flexible role.
Absolutely, but the whole site is flexible, the whole staff are flexible, from delivering inpatient care to delivering crisis and treatment care from the units, from staff being flexible. So they'll arrive on shift in the morning, they'll be going out on home treating people that they've worked with as inpatients, they'll be doing inpatient work, they might do a crisis assessment, and it's just complete flexibility.